I know that this is a hard topic. If you're watching it, it means that you're already considering it, so I hope I can provide you with some guidance. I'm Dr. Orion, a veterinarian and a veterinary behavior residency graduate. And this is what you'll need to know to make a good decision about: is it time to euthanize your pet? Is it time to let it go? Choosing to say goodbye, choosing to euthanize your pet, your beloved dog that's been with you for maybe many years, is never an easy thing to do. There are some things that might make it somewhat easier for you to decide if your pet is experiencing low quality of life or suffering and it's time to let go, or is it still something that's fair and something that's tolerable for the pet to endure. And for you, by the way, because you're there with the pet, and you might also be suffering from your pet not being a healthy pet anymore. The first thing to look for is the quality of life. There isn't a scale that I can tell you, okay, look at this and this and this and this, and tell me if the pet's quality of life is good or not. So many times I will leave this determination for the owners to make, because you know much more than I do if your pet is suffering or having a good quality of life, because you can see the difference between now and what it used to be a week ago, a month ago, a year ago. If you believe that your pet doesn't have a good quality of life anymore, then basically I trust you. Of course, you can ask your veterinarian and ask if he or she believes that this is something that indicates a decline in the quality of life. Another thing we use to decide if it's time to say goodbye or not is the pain and suffering of the animal. Of course, that also relates to the quality of life. If it seems like the animal in pain, it's hurting itself, it's not able to walk around without crying, it's whimpering all the time, it might not be able to lay down or sit down and be walking and pacing around all the time, or it might be just the opposite. Anything that looks so severe and so chronic and is not responding to the medications can be a good indicator. Terminal illness or disease is a very big one, because if we do know that your pet is suffering from some kind of incurable cancer, or has a chronic kidney disease, and we did everything we can to help manage it, to slow it down, or even to cure it. For example, in some types of cancers, we might be able to remove the mass, but nothing is promised by doing that. If we tried everything and the animal is just continuing to decline, then yes, that's another reason to say goodbye. Loss of vital functions is another big one, because we can see if the animal is not eating anymore, is not walking anymore, not drinking, not breathing, all those behaviors that are normal behaviors or normal actions for the pet to do, and all of a sudden it's not even doing those things which are very important for the well-being of the pet, then we might recommend euthanizing. Very severe behavioral changes or cognitive changes, for example, a dog that now barks non-stop because of cognitive changes, not because there's something triggering the barking. And of course, you did try to address those issues. And it's not just barking, of course. It can be other things. It can be the dog gets lost in the house, gets stuck in corners or behind the door or under furniture. The dog forgets everything that he or she learned before, so defecating, urinating in the house, forgetting that he already ate and trying to get more food. Many of those changes, if we can't really do anything about, and it does seem to affect everyone's quality of life, will also be a reason to say goodbye. You don't have to make the decision by yourself. You can bring up all of the changes that you noticed to your veterinarian. You can even make a list. You can have all of the family sit together and talk about it and make the decision calmly. In the end, we're all here to make the pet feel better, or at least not feel any pain anymore. Many times there's no black and white. It's going to be sitting somewhere in that gray area. So the decision is not going to be an easy one. So you can go over this list that I gave and try to see how many of these things are there and how severe they are. Sometimes you might only need one of these things, but it's going to be very, very, very severe and affecting the dog's quality of life. In other cases, it might be a little bit of things here, but only also on that one and this one and this one, like all of the different categories, and that will also be a good reason. Now, I also encourage you to go and seek support of friends and maybe even professionals while making the decision or after making it. You definitely don't want to be dealing with it by yourself. It's a lot harder than people would think. I might not be able to help you with your own pet, but if you have a general question, please feel free to comment down below and I will answer it as fast as I can.